Televisa presenta
Lo que se viene a continuación. En MP3. En MP3.
Interview Job.
Team Lcmh Y Jvd.
And Jorge Villagrán Durán.
Part 1. Interview questions. Credential verification. What is your nursing degree and where did you get it?
As a Bachelor of Nursing from UAMX.
Do you have an active license to work as a nurse? In which states or countries do you have permission to work?
Yes, my professional license and it always from to work anywhere in the country.
Have you completed any additional training or course in areas like emergency, critical care, or geriatrics?
Yes, we are always taking course on everything.
Part 2. Experience verification. How many years of experience do you have as a nurse?
Around 7 years.
In which institutions have you worked before and what kind of patients did you care for?
All kinds, renal, cardiac, geriatric patients, and some with very rare conditions. I've been almost all hospital in Toluca.
Have you worked in the multidisciplinary teams? What was your role in those teams?
Yes, in the operation room as a circulate nurse and in instrument technician.
Part 3. Opinion questions. In your opinion, what is the biggest challenge nurses face today?
Hearing the same respect at doctors.
What personal skills do you think are essential to be a good nurse?
Leadership, mastery of specials, problem resolution, communication, teamwork. I think these are the most important.
How do you see the future of nursing in terms of technology and patient care?
Very optimistic and practical. 18% of interview wheels and technology with few things do high people.
Part 4. Behavior questions. Tell us about a time when you had to take care of several patients at the same time. How did you manage the workload?
The first time was difficult, especially the keen few hours. But I think if you are organized, you know how to manage your attitude. And I think the shift went well.
Describe a time when you had to handle a difficult situation with a patient or family member. How did you resolve the conflict?
It's hard because you feel some of what they feed you, but I show strange. They peasants a little, and with good explanation, they feel they are in good hands.
How do you react to unforeseen or emergency situation in the hospital setting?
In the moment, you shouldn't show weakness. You have to know how to save the situation and later on private. You release your emotions.
Part 5. Competency questions. How do you make sure you follow health and safety protocols at all times?
In following the official Mexican standards and the code of ethics that over time. Oh yes.
How would you make decisions about priority care in a situation with limited resources?
Optimizing recurse, classifying interventions, the priority, and using the recurse I have on hand. Do you do it well?
How do you handle a situation where you have to apply treatments that might cause discomfort to the patient?
Explaining everything in the patients and especially reminding them that is for their health.
Thanks.